Welcome back. Today's episode is a message every CNA needs to hear, especially on those chaotic shifts when you're short-staffed, the call lights won't stop, and someone says, just do it real quick. Because in healthcare, one real quick mistake can cost you your certification, your job, and your future. So let's talk about staying in your lane. Not because you don't care, not because you're not capable, but because scope of practice exists to protect your residents and to protect you. Here's the rule I want you to remember. If someone asks you to do something you've never been trained to do, stop. Ask questions. If you're not sure whether it's allowed, don't guess. When you guess in healthcare, people get hurt, and your name ends up on the report. Let's get specific, because this is where CNAs get pressured the most. First up, Hoyer lifts. If the care plan says it's a 2-person Hoyer transfer, it is a 2-person Hoyer transfer. Period. Don't let anyone talk you into doing it alone because the unit is short. If something goes wrong, if the sling slips, if the resident panics, if they fall, you won't be comforted by the fact that you are trying to help. You'll be thinking, I should have waited for help. Follow the care plan and your facility policy, even when it's inconvenient. Next, medications. This one gets people in trouble fast. Don't pass medications. Don't hand medications to residents. Don't decide which pill they should take or when they should take it. Unless you are in a state and a role where you have specific additional certification or delegation that clearly allows it, medication administration is usually outside a CNA's standard scope. If someone tries to put that responsibility on you, that's your sign to pause and pull in the nurse. Now, colostomy care. You may be allowed to help with routine hygiene, and you may be allowed to empty a colostomy bag if your facility permits it and you've been trained. But changing the appliance, replacing it, or doing anything that crosses into more advanced ostomy care is often not within the traditional CNA role, unless your state rules and your employer specifically allow it. When in doubt, clarify before you touch it. Let's talk about tracheostomy suctioning. Do not suction a trach unless you are specifically trained, specifically authorized, and it's clearly within what you are permitted to do in that setting. This isn't a watch me once and you'll be fine skill. If you're not cleared to do it, you're not cleared to do it. Wound care is another big one. Don't change wound dressings. Don't do sterile wound care. And definitely don't make statements that sound like you're judging the wound clinically, like, it looks infected, or it's getting worse. Your role is to observe and report. You can say what you see in plain terms. More drainage than yesterday, a new odor, increased redness around the area. The resident reports more pain. Then you notify the nurse. Wound care decisions require licensed nursing judgment. Feeding tubes. Don't insert feeding tubes. Don't start tube feedings. Don't adjust settings. Don't change rates. Those tasks are generally outside the standard CNA scope, and they carry real risk when done incorrectly. If you're concerned something isn't right, like the resident appears uncomfortable, the tubing looks disconnected, or you see leakage, get the nurse immediately and report exactly what you observed. Foley catheters. Don't insert them, and don't remove them unless your state and your facility have a very specific allowance for your role. In most places, insertion is not a CNA task. If someone tries to hand that off to you, that's not teamwork. That's putting you and the resident at risk. Oxygen is another area where people get tempted to improvise. Don't decide to increase or decrease oxygen flow because someone looks like they need more. Oxygen is a medication. If you think something is wrong, if the resident is short of breath, confused, turning pale or blue, or you're seeing concerning numbers, get the nurse right away. Your good instinct matters, but changing the flow rate without authorization can create harm and can create liability. Now let's talk about assessments and diagnosis. This is where even well-meaning CNAs can accidentally step over the line, especially when families ask questions. Never tell a family, I think your mom has pneumonia, or he's having a stroke, or that looks like an infection. Don't diagnose. Don't interpret symptoms like a clinician, and don't label what you're seeing. Instead, keep it professional and safe. I'm going to let the nurse know what I observed. And don't underestimate how powerful your observations are. CNAs are often the first to notice changes: appetite, mood, breathing, skin, pain, mobility, confusion. That's a huge strength. Just remember, noticing and reporting is your lane. Diagnosing is not. Now we need to talk about something even bigger than scope: resident abuse and neglect. This is non-negotiable. Abuse isn't only physical. It can be verbal, emotional, or psychological. It can be bullying, rough handling, threatening someone, humiliating them, ignoring them, or withholding care. Neglect counts too. Stress does not justify disrespect. Being overwhelmed does not give anyone permission to be cruel. If you feel yourself getting frustrated, you step back and get help. Protecting dignity is part of the job. And right alongside that, falsifying documentation. This is one of the fastest ways to lose trust and lose your career. Never chart care you didn't provide. Never chart vitals you didn't take. Never sign someone else's documentation, and never let anyone sign for you. Documentation is a legal record. If it's wrong, it doesn't just look bad. It can become evidence. Before we close, I want to add one piece of advice that can quietly protect your job more than you might realize. Read your employee handbook. I know it's tempting to sign the papers on day one and toss it in a drawer. But your handbook spells out what your employer expects, what you're responsible for, and what policies you're required to follow. It usually covers attendance, reporting concerns, abuse and neglect policies, confidentiality, professional conduct, and how discipline works. When you know the policy, you make better decisions. And when someone pressures you to do something that doesn't feel right, you have a professional way to respond without arguing. You can say, "I'd like to check our policy first," or, "Can you help me understand if that's within my role?" That's not being difficult. That's being safe. Always remember this. Just because someone asks you to do something doesn't mean you should do it. Your certification represents your integrity. Stay within your training. Ask questions. Protect your residents, and protect your career.